All right, so for this video, we're going to go over some of the musculature that we're going to see in or along the thoracic cavity as well as the abdominal cavity. So what we're looking at is a lateral view of this canine cadaver. We can see a few muscles that have previously been transected, including the latissimus dorsi, which I'm going to reflect dorsally, as well as some of the cleidocephalicus muscle here cranially. So now we see some of these deeper muscles of the thoracic wall, namely this muscle right here, which we've previously dissected, this kind of serrated looking muscle that has multiple fascicles. This is going to be the serratus ventralis, and that's the cervicis and thoracis. Just ventral to that, you have this long sweeping muscle right here coming down from the cervical vertebrae and attaching onto the first few ribs. That's going to be the scalenus muscle. Just ventral to the scalenus muscle is this small muscle that's right at or lying over the first few ribs. That's going to be the rectus thoracis muscle. And it's usually along the same plane as the rectus abdominis muscle. Now we can reflect a few of these muscles and go to some of the deeper muscles. Once we reflect that serratus ventralis muscle, we can now see another serrated muscle that's attaching to the dorsal aspect near the ribs. That's going to be the serratus dorsalis cranialis because it's in the cranial aspect. And then we see a few of these fibers back here attaching to the last or most caudal few ribs. That's going to be the serratus dorsalis caudalis. So caudalis is attaching to the last few ribs. Cranialis is attaching to the cranialmost ribs. If we transect that muscle and reflect it dorsally, we now see some of the epaxial musculature. This is is going to be the muscles that are referred to as the I love tacos or ILT muscles. And that's going to be this lateral most muscle, which is the iliocostalis system. You will then see the middle, which is the longissimus system. And finally, the most medial portion, which is the transversospinalis system. And for these muscles, whenever we're discussing the iliocostalis and the longissimus, it's going to be referring to the region of the spinal column that it's along. So back here we would have the iliocostalis lumborum. Here attaching near the ribs is going to be the iliocostalis thoracis. And finally, the cranial most few little fascicles is going to be the iliocostalis cervicis. We will then see again this middle muscle here, which is the longissimus, and back here it would be the longissimus lumborum. Whereas up here we can see some of these tendons attaching onto the ribs. That's going to be the longissimus thoracis. In the book it calls this combined muscle the longissimus thoracis et lumborum, which just means the thoracic and lumbar part. Next, as we move a little further cranial, we see this longissimus muscle continues cranially as the longissimus cervicis attaching to those cervical vertebrae. And finally, the cranialmost portion, this single strand of muscle going up towards the head, which is the longissimus capitis. There has been a muscle that has been transected and reflected here that would be normally lying over top or superficial to that longissimus capitis. This is the splenius muscle. And if we transect and reflect that splenius muscle dorsally, we see the semispinalis capitis muscle, which is this muscle just deep to the splenius. We separate that into the semispinalis capitis with the most dorsal aspect being the biventer surfaces. And that kind of looks like vents is what I heard, or you also see these tendinous intersection here. That is the biventer surfaces. And just ventral to that is the complexus. If you separate the biventer cervicis and complexus, that is where we can get down here to see the nuchal ligament, deep down, which is right on the midline, the dorsal midline, deep to all these muscles. Now, while we're here, a few other structures that I would like for you to be able to see is, let me kind of reset some of this. So again, we're looking at the cleidocephalicus muscle, specifically the pars cervicalis. If we reflect that muscle and look right as it's coming through, there's a nerve that's coming right through that muscle right here, just caudal to the wing of the atlas. This nerve is going to be the second cervical spinal nerve, or C2, and it gives off a couple branches here. This one that's going up towards the caudal aspect of the auricle, or the ear, and that's going to be the great auricular nerve. And then you see this large nerve that's running superficially over what would be the external jugular vein. That's going to be the transverse cervical nerve. So the great auricular nerve and transverse cervical nerves are branches of the C2, or second cervical spinal nerve. If we reflect again, if we kind of reflect this cleidocephalicus muscle cranially, just deep to that we will see a nerve that's actually going to be running right next to C2, but it's moving caudally. This nerve that's supplying this muscle is going to be the accessory nerve. Another name for the accessory nerve is the 11th cranial nerve. So this is actually a cranial nerve originating from the brain stem.